Now let me speak about growth modulation procedures. Generally, when we speak about the problems which are occurring at the jaw level, as I explained you, upper jaw is maxilla, lower jaw is mandible. When they are mal-related, they are not related properly. So there are procedures which we can do to correct this mal-relationship. Okay, so the most commonly being something called as, everyone would have seen patients or the small kids wearing a head cap, okay, or else in our terms we call it as headgear, okay, or else a myofunctional appliance which generally tends to position the jaw forward or backwards according to the requirement and correct the position of that. Okay, for this kind of treatment, obviously the growth is a very important criteria. Okay, so obviously all these procedures can only work at that particular growth period. Now we all know that growth is not linear. I mean to say that not not no it is something all the individuals wouldn't grow at the same, you know intensity all through the life. Basically, there are certain period of time where the growth overtakes the general rate of growth, rate of development. Say for an example, we generally term it as growth spurts. Okay, this growth spurt is a period where there will be a lot of dynamic changes happening within the tissues. That particular tissues will be growing at a much faster rate than the rest of the tissues. So these growth spurts are very important to time our treatment. So orthodontics as a science, obviously we have to take this growth status into our treatment plan, okay? Because these myofunctional appliances can only work when there is active growth involved. So generally we all know these growth spurts, as I explained to you, generally happens at different various stages of development. Obviously the moment once a small child is born, 1 year after the birth there is a growth spurt. The second growth spurt generally happens at around about 6 years of age. The third, which is a very smaller growth spurts, can occur at age of 9 to 10 years, whereas the major growth spurts, otherwise known as pubertal growth spurt, generally which will have both the quality and the quantity of growth, which is very much excess when compared to the other growth spurts, occurring at around somewhere about 11 years till 15 years. Generally girls tend to grow much more faster. For them it can occur anywhere between about 11 to 13 years of age, whereas for boys it can be later, say about 12 to 15 years or sort of 13 to 15 years of age. This is the period where the growth will be at its peak. So when we speak of growth modulation, this is the growth spurt generally we target. Okay, unless we are dealing with, again there are exceptions for all these things, unless we are seeing a very severe malocclusion at a very early stage of life, that's the exceptional cases where we institute these growth procedures aiming at the prepubertal growth spurt, not exactly the pubertal growth spurt. Okay, so whenever we institute this treatment when there is active growth, so because the growth is happening, the jaw tends to come forward or to go back, however it's required, what's required for that particular case. Okay, so now once we finish this active phase of growth, say today about the growth spurts. So now let us think that the patient has completed its growth spurt. Now getting the jaw is not an option what we have in the orthodontist. So in that case, when we speak about comprehensive treatment, we just have to wait till the patient completes their growth quantum. So what that generally happens around 18 years of age. Any individual can grow actively till 18 years of age. Still, there is some amount of growth still left which can go on till about 25 years. I'm speaking of active growth, whereas passive growth keeps happening all through the life. Okay, this active growth is the quantum of growth which is slightly more than which can happen for the rest of life. So we need this growth to stop to correct the jaw problems at the later stage. If we are not able to see the patient or catch the patients at a right growing age, then we will have to wait till the growth is over, then do jaw surgeries to correct the jaw problems. So obviously it makes sense to catch the patients young and correct them without much intrusive procedures like orthodontic or jaw surgeries.